Kunzman, MD, and today we're talking about digestive enzymes because this is a topic that I discuss nearly every day with my patients. And it has become so commonplace that I almost forgot we needed to talk about it. So, why do I talk about this on a daily basis? Well, there are so many symptoms and conditions that in the very bitter end will respond quite nicely to digestive enzymes for a reason. So the classic patients that will present to me requiring digestive enzymes are those who have heartburn, gas and bloating, constipation, lactose intolerance, which is very common, acid reflux or food allergies, food intolerances. Little lesser known would be the migraine sufferer or those with sinusitis or stress. Then there's classically just some of the aging issues that go along with our digestive system. Some of our immune disorders may wind up affecting our gut and our digestion. Irritable bowel syndromes, which is obvious, chronic diseases in general, nutritional deficiencies, weight loss, some of those people with leaky bowel syndrome, as well as fatigue and lack of energy. And honestly, how many of you have had these symptoms either ongoing now or in your past? Nearly all of us. So let's quickly go through a few of the enzymes that are required on a daily basis. Well, we've got amylase in our body, and that breaks down our carbs and our starches, and to a degree this is also what lipase will do. Amylase and lipase are secreted to a small degree in our saliva, but primarily in our pancreas. So as a reminder, our pancreas is not just for insulin production. Our pancreas is there for our digestive properties and our digestive functions. Then we have maltase. That also will break down carbohydrates. On to protease, pepsin, tryptase, and peptidase. These are the four main categories, I would say, that work on the protein breakdown and the protein enzymatic functions, and that's mostly in the mouth and the small intestine. And I really should also say that the whole concept of enzymes are so they can take bigger pieces and break them down into smaller pieces so that they can actually be absorbed and made small enough for our cellular functions. Lipase also, I would say, in a much bigger sense than any of the little bit of the carbohydrate breakdown, is with the fats broken down. And occasionally you will have some carbohydrate, lipid, moieties, but primarily lipase is there to break down our fats. Of course, it is also manufactured in the pancreas. Then we have our nuclease and nucleotidase. Now, what are those enzymes? Well, they are designed to break down nucleic acid. Nucleic acid is found in our DNA and our RNA, and what they do is aid in the breakdown, but also the repair mechanisms in our DNA and our RNA. That also is found in our pancreas, so we're finding that that pancreas is quite important. So what are those things in life that can make us deficient in our digestive enzymes? Well, here we are in America, so we have a lot of pesticides and chemicals and toxins in our environment that get into our food sources. We also have some heavy metals that may make their way into our bodies and will render those digestive enzymes much more reduced or defective. Now, there are some diseases that can actually weaken the body's ability to produce the digestive enzymes, and one of the biggest ones is cystic fibrosis that renders the pancreas nearly non-functional. And if that pancreas is non-functional, there goes most of the digestive enzymes that are secreted. Interestingly too, eating too fast and chewing your food thoroughly, let's say, is a common reason for seriously disturbed digestion. So the manner in which we go about chewing already can affect our digestive enzymes or the ability for these enzymes to work. Some enzymes will come from our gut bacteria once they have been rendered down, and they may be off ratio or may have succumbed to a lot of antibiotic therapy, and they are markedly reduced as well. Consuming processed food, again an American phenomenon, can actually deplete the body of the digestive enzymes and can cause all of these digestive problems that I mentioned in the beginning. And simply as we age, the body's ability to produce these digestive enzymes becomes a lot weaker. So, for instance, once we hit about age 40, the level of the enzyme production goes down about 25%. So there are some natural and food-based ways for us to get more of these digestive enzymes. Honey, especially raw honey, has amylase and it actually has protease. Mangoes and bananas have a lot of that amylase, which will actually help the fruit to ripen as well, but they are high in that enzyme for us to break down our carbohydrates. Papaya has a protease called papain. Pineapple has bromelain. Avocados actually carry a lot of the digestive enzyme lipase, and again, remember that primary breakdown in that enzyme is for the fats. We also can do vegetable juicing every day because a lot of vegetables are high in these enzymes. When we eat sauerkraut or fermented cabbage or other fermented products, there's a lot of digestive enzymes that will get released during that fermentation process. Of course, there are some great digestive enzyme products that you can actually take supplements on a daily basis, and some of the best ones I've seen have a whole lineup of some of these vegetable-based enzymes, and a more varied or more robust digestive enzyme will help you in your process. Now there is betaine, which is also called trimethylglycine, and that comes from the breakdown of choline in our bodies. But you can actually supplement with that, and a lot of times what that will do is help us change our pH environment, because a lot of these enzymes will do their job in a higher acidic environment, which is in the stomach. And to a side note, we're on a lot of medications for some people that are lowering our pH, so we may need to balance that back with some betaine. Lemon can also do somewhat of a reasonable job to help us with that approach as well. So there you have it. The digestive enzymes are typically one of my first strategies after I have a patient clean up their diet in general. So a patient may come in with a lot of digestive complaints. The foundation to management is cleaning up the diet and getting onto a whole foods, a lot more plant-based, and hand in hand with that, I will have them add in digestive enzymes. I'll have them do digestive enzymes empirically or as a trial many times long before I go looking at food intolerances, because this may be enough to correct the ship. And you did not hear me talk about probiotics. I believe digestive enzymes need to be approached before we even go after the probiotics and prebiotics, because that can make some of patients' digestive situation even worse with gas and bloating and intolerances. Again, I'm Natalie Kunzman, MD, subscribe to my channel below, and until we meet again, be well.